Good evening, everyone. Am I audible? Am I audible? Please respond in the chat box, please. Please tell other students to join. Okay. Good evening, students. As you all know, today we are going to start with our previous year questions. We are going to solve the previous year questions today. Okay. So I want all of you to just actively participate in this session. I will ask you questions and you have to respond in the chat box. Okay. Is that clear? Please respond in the chat box. Within 1 minute, we are going to start with a session. Okay? We will wait for another 1 minute and we will start with a session. Okay. So today we are going to solve previous year question paper. Basically, these questions are from RML 2025 prelims questions. Okay. So the first question is, according to Maslow's hierarchy of needs, which of the following is the primary? Means the first need according to Maslow's hierarchy of need is, first is safety and security, love and belongings, physiological need, or self-actualization. So please answer fast. According to Maslow's hierarchy of need, which need comes as, or which need is the primary need? C. Okay. Where are the other people? Please respond. Okay, C. Very good. Answer is coming. Okay. Two people have answered physiological need as the primary need according to Maslow's hierarchy. Okay. So Maslow's hierarchy has a 5 parameters. The base one is the primary. From base, it's the top priority. And as we go up, it's the least priority. Okay. So the first one is physiological needs. Physiological needs are the food, water, sleep. These all are the physiological needs. Then comes safety and security. Safety and security needs. And the third level is love and belonging. Then the fourth one is self-esteem. Okay, self-esteem means confidence, achievement. Okay, these all comes under self-esteem. Then comes self-actualization. Self-actualization means personal growth, the purpose of life. Okay, and then achieving goals. These all comes under self-actualization. So this is the Maslow's hierarchy of needs. I want you people to just note all the things which I am going to tell you today. Okay, shall we move forward? Okay, okay, Geeta. So the second question is, which drug is used for immediate relief in chronic bronchial asthma? Good evening. Good evening, Geeta. Okay. Second question is, which drug is used for immediate relief in chronic bronchial asthma? First one is inhaled corticosteroids, that is budesonide, beclomethasone. Second is leukotrienes receptor agonist or montelukast. C is short-acting beta-2 agonist, that is salbutamol, albuterol. D is long-acting beta-2 agonist, salmeterol and formoterol. So what is the answer? Immediate relief in chronic bronchial asthma. A and C can be. Okay, let's see. A. Why A? C. Goldie Chan is saying C. Gayatri saying C. Okay. Why C? Anyone is having the reason or a rationale? Okay, let's see. So inhale, let's talk about inhaled corticosteroids. So the inhaled corticosteroids prevent inflammation and used for long-term control. And long-term control, that means, ma'am, because salbutamol used to relieve the asthma attack and corticosteroid is for inflammation. Very well, very good. Okay, so I have told you that inhaled corticosteroid is used for long term. That means no immediate effect. It is the question itself is saying immediate relief. Okay, so this is wrong. Then coming to leukotrienes. Leukotrienes, that is montelukast. So the montelukast is for maintenance therapy. Maintenance therapy. Okay, not for immediate relief. Then coming to, so this is also wrong. Then coming to D option, long-acting beta-2 agonist. The name itself is saying long-acting. That means for, again, for long-term control, not for acute attacks. Okay, but short-acting beta-2 agonist, it is for immediate relief. What it does? Rapid bronchodilation. Okay, that's why answer C, short-acting beta-2 agonist is the correct answer. for rapid relief in case of bronchial asthma, chronic bronchial asthma. Okay, shall we move forward? Okay, third question. Iron deficiency anemia is mostly seen in which age group of children? A. Neonate 0 to 28 days. B. Infants and toddlers 6 months to 2 years. C. School age children 6 to 12 years. Adolescents 13 to 18 years. Okay, please be fast answering this question. D. Gonmi is saying D. Anyone else? Iron deficiency anemia is mostly seen in which age group? Is it neonate, infant and toddlers, school age children, or adolescent? B. Goldigen B. Okay. Any other answer other than B and D? A. Gayatri A. Please, along with your options, just give me the rationales also. Why A, B, or D? Why not C? Okay. So, in my pediatric class, I have already told that maximum growth and development occurs at infant age group, infant and toddlers age group. So, as the growth and development occurs, the iron stores also depletes. Okay. So, the answer is infants and toddlers due to maximum growth and development. Okay. Got it? Okay. Then question 4. What is the first step in managing a bleeding wound? Apply a tourniquet, apply direct pressure on the wound, elevate the limb over the heart level, or clean the wound with apply ointment. B. Geeta B. Okay. Any other? B. Okay. Any other answer other than B? B. Okay. So the first step in managing a wound bleed, yes, B. So the answer is apply direct pressure on the wound so that the bleed stops. Okay. Then all this comes later on. Elevate the limb above the heart level according to the bleeding. Then clean the wound with and apply ointment. Nothing to do with this. Apply a tourniquet. Nothing to do with this. Okay. So the first priority and the first step in managing a bleeding wound is apply direct pressure on the wound. Okay. Then the fifth question. Which of the following is a loop diuretic? Furosemide, hydrochlorothiazide, spironolactone, or acetazolamide. Loop diuretic. A. Gayatri A. Okay. A. A. Okay. According to all of you, the answer is furosemide. Another name of furosemide, please be fast. Another name of furosemide is Lasix. Very good. Lasix. Very commonly called it as Lasix or furosemide. So the furosemide is a loop diuretic. What it does? It increases water absorption. It promotes water excretion from loop of Henle. Loop diuretic. Diuretic, what does diuretic means? Increases water. Yes, yes, yes. Okay, okay, Geeta, very good. Decreases water absorption. Okay, very good. So what does Lasix do? It is a loop diuretic. It promotes water excretion from loop of Henle. Okay. Whereas, and where there is water, there is also sodium. Sodium and water has a loving bond. So when the water excretes out, sodium also says, I will also go out. Okay. Sodium and water excretion. Hydrochlorothiazide. It is a thiazide diuretic. Yes, Geeta, cute couple. Yes. Whereas spironolactone, it is a potassium sparing diuretic. Whereas acetazolamide, it is a carbonic anhydrous inhibitor. Okay. If the question comes, like this question is, which is a loop diuretic, and if the question comes, if the patient is having potassium level more than normal, for example, the normal range of potassium is 3.5 to 5.5. If the potassium of the patient is 7, which of the following is contraindicated? Diuretic is contraindicated. Then the answer will be potassium more than 5.5. Contraindicated, diuretic. Yes, C. Okay, Geeta, C. Why? Why C? Because pyroelectron is a potassium sparing. Yes. Okay. Very good. So the answer contraindicated will be spironolactone because it is a potassium sparing. It will leave the potassium within the body. Yes. If already potassium high. Very good. The contraindicated will be spironolactone. And the loop diuretic is furosemide. Yes. Very good. Then Which part of the brain regulates temperature, thirst, and hunger? Cerebrum, hypothalamus, medulla oblongata, or cerebellum? Yes, B. Very good. B. Yes, B, guys. Okay. So the answer is hypothalamus. What does hypothalamus does? It regulates temperature, thirst, and hunger. Okay. What does cerebrum does? Cerebrum does thinking, memory, and intelligence. Yes, all the answers are correct. All of you have given the correct answer. Very good. Cerebrum does thinking, memory, and intelligence. Hypothalamus, temperature, thirst, hunger. These all three controlled by hypothalamus. Then comes the medulla oblongata. Medulla oblongata controls breathing, heartbeat, and blood pressure. Okay. Whereas cerebellum, what does cerebellum does? It balances and coordinates. That means coordination. Balance and coordination is controlled by cerebellum. Okay. So the mnemonic can be for the hypothalamus. Hypo, heat, hunger, heat, and hydration. 3H is controlled by hypothalamus. Got it? Are you writing all the notes? These all will be very important. So I request all of you to just make the notes also. Okay? Okay. Okay. Very good. So next question. Which of the following is a fat soluble vitamin? Vitamin B12, C, D, and B2. First tell me fat soluble vitamin and water soluble vitamins. Name the water soluble and fat soluble vitamins. C. Very good. My next question is fat soluble and water soluble vitamins. Fat soluble A, D, E, K. Very good. Water soluble B and C. Very good. So the fat soluble vitamin A, D, E, and K, and water soluble is vitamin B and C. The correct answer is D. Fat soluble vitamin is vitamin D. Got it? Next is before admin. Very important also. This drug is very important. In MSN, your teachers will be discussing this topic with you. Digoxin is very important. Before administering digoxin, the nurse priority assessment is to check blood glucose level, to check heart rate, to check blood pressure, or to check the respiratory rate. B, B, C. Gayatri is saying C. Geeta, B. Please also provide me with the rationals. Why B or C? Another option? Digoxin is cardiac glycoside. Very good. And one more question. Which digoxin therapy is called which therapy? That's why. So it will directly affect the heart rate. That's why we always monitor apical pulse. Okay. Okay. Which therapy is called while we give digoxin? What is the name of the therapy? What is the name of the therapy? ये तो नहीं पता मैम. Okay, I will be telling you. So the therapy is digitalis therapy. Okay, this therapy is called digitalis therapy. Okay, let's see what all we have to consider while giving digoxin. Okay, so digoxin. Oh shit, ये तो पता था. Okay, okay, okay. Digoxin. So digoxin causes bradycardia. Okay. So before giving digoxin, we have to monitor heart rate, the apical pulse. Okay, if it is less than 60 beats per minute in an adult, then the doctor prescribes or doctor says that don't give the digoxin tablet. Okay, if the heart rate is less than 60 beats per minute, then stop giving digoxin because digoxin causes bradycardia and next arrhythmia and also digoxin toxicity. Okay, so the answer, the priority will be to check the heart rate, especially the apical pulse. Okay, got it? Okay, the next question is Leopold's Manual. It's from Leopold's Manual. Again, important question from OBG and Gynae. I will be discussing this topic with you, okay? Leopold Manual are done for all following purposes except to determine fetal lie and presentation, to determine fetal position and attitude, to determine degree of engagement and presenting part, to determine fetal weight accurately. Geeta is saying D. Other people, Gayatri D. Okay, Gonmi D. Very good. So, what all? Okay, Goldigen D. Okay. Leopold's Manual. What all we assess in Leopold's Manual? It's fetal lie. You all know na Leopold Manual? Leopold Manual is basically abdominal palpation, which is done in pregnant ladies, pregnant women. Okay, with the help of abdominal palpation in the pregnant woman, we used to see fetal lie, fetal presentation, attitude, and then position, engagement of the presenting. Okay, so first one is saying fetal lie in presentation. Yes, we see fetal position and attitude also. Yes, to determine degree of engagement of presenting part. Yes, so the answer will be except. Except is to determine fetal weight accurately. It is through USG. Okay. through USG. Got it? Shall we move forward? Okay. So the 10th question. KMC is primarily recommended for which babies? A. All preterm and LBW babies. All term baby. Only critical ICU babies in NICU. Only babies above 2.5. A. A. Any other answer? So KMC is basically for all preterm and LBW babies. What is the benefit of KMC? Benefit of KMC: maintains body temperature, then promotes breastfeeding, then improves bonding, then reduces risk for infection, then helps in weight gain. Okay. Anyone knows what are the components of KMC? Components of KMC. Kangaroo mother care. What are the components of KMC? Yes. Okay. No one knows the components of KMC? Position, skin to skin contact, nutrition. Okay. Okay. Let me modify this. So the first component of KMC is skin to skin contact. Yes, very good. Ma'am, network slow. Whose network slow? Ma'am, can you please repeat the question? Okay. Geeta, question is, kangaroo mother care is primarily recommended for which babies? Okay, okay. Kangaroo mother care is primarily recommended for which babies? All preterm and LBW, all term babies, only critically ICU baby, or only babies above 2.5 kgs? Okay. The answer is all preterm and LBW. Okay, very good. So these are the benefits of KMC. These are the benefits of KMC, like maintaining the body temperature of the baby. It promotes the breastfeeding, improves bonding. Okay, and then it also reduces the risk for infection, and also if the baby is exclusively breastfed, then it will help the baby to gain weight. Okay, next is components of KMC. First component is skin to skin contact. Okay, the mother and the baby is having skin to skin contact. Okay. So my question to you all is, who all can give KMC? Is it only the mother or anyone in the family? Who all can give KMC? Is it only the mother who can provide KMC to the baby? Anyone in the family? Very good. Anybody in the family? Very good. Okay, very good. So anyone in the family can provide KMC. It can be mother-in-law, okay, father, anyone. Second component is exclusive breastfeeding. Then comes third is early discharge and follow-up. Okay. These three are the components of KMC. Got it? Is it clear? Let's move forward. Okay. The most common type of episiotomy performed worldwide is median, mediolateral, lateral, or J-shape. B, mediolateral, B. Okay. Any other? B. Okay. Let's see which one is the correct one. Median is also common. Also common. But if we perform, if the obstetrician performs the median, then there is a risk of anal sphincter injury, okay, or tear. There can be or there is a risk of anal sphincter tear, okay, and the injury can be of even third grade or fourth grade. There is a high level of injury or tear. So this is wrong answer. Then comes mediolateral. It reduces risk of extension to anal sphincter or rectum. Okay. And this is less common and this is also rarely used. So the answer would be mediolateral. Okay. Got it? Okay. Then next question is, anterior fontanelle normally closes at which age? At birth, 6 to 8 months, 12 to 18 months, or 3 to 5 years. I've already told in my pediatric class that this fontanelle question is very important. And look, RML 2025 already in prelims, already this question is there. C. Very good. At 12 to 18 month, anterior fontanelle closes. Another name of anterior fontanelle is another name for anterior fontanelle. Yes. Another name for anterior fontanelle. Another name for anterior fontanelle. Shape. Bregma. Very good. Another name for anterior fontanelle is bregma. What is the shape of anterior fontanelle? Diamond shape. Very good. And posterior fontanelle, what is the shape? And another name for posterior fontanelle? Name and shape. Yes. And shape is also lambda and also triangular. This is anterior fontanelle. This is the posterior fontanelle. Okay, very good. Then next question. During vasopressin therapy, which parameter must be monitored most closely? First, heart rate. Second is BP. Third is urine output. And then the serum electrolytes, especially sodium. Yes, C. Urine output. C. Why C? Why C? The answer is it causes urinary retention. What is the question? Answer is the question is Geeta, during vasopressin therapy, which parameter must be monitored most closely? I'm confused between BP and urine output. C. So the vasopressin in the vasopressin, what it does, it is antidiuretic hormone. Okay, so causes urinary retention. So the answer is urine output. Very good. Got it? Next question is, at what gestational age is the anomaly scan, that is the level 2 USG, usually done? 8 to 10 weeks, 11 to 13 weeks, 18 to 12 weeks, or 28 to 32 weeks? Anomaly scan. What it does, used to assess the detailed fetal anatomy and detect structural abnormalities. Okay, B answer. Okay, just remember it. Anomaly scan is done at 18 to 22 weeks. Very good. Gone me. Very good. 18 to 22 weeks. Okay. So the next question, what does empathy mean? Empathy meaning feeling pity for someone suffering, ignoring one's own emotion for other, advising someone during a problem, sharing and understanding another person's feeling. What is the meaning of empathy? Yes, meaning of empathy. Yes, very good. So empathy means sharing and understanding another person's feeling. Very good. Then, which is the most commonly used disinfectant for hospital surface cleaning? Phenol, 70% alcohol, sodium hypochlorite, or hydrogen peroxide? Yes, C, C, C. So the answer is very good. Sodium hypochlorite. It is also called bleach solution. Okay. These are used for floor cleaning, blood spills, and high touch surfaces. High touch surfaces. Okay. And it is effective against bacteria, virus, and fungi. Okay. Whereas alcohol, 70% alcohol is for skin asepsis, skin aseptic. Okay. And phenol, it is rarely used due to toxicity. Okay. Whereas hydrogen peroxide, it's is used in some specialized cases. Specialized disinfection. Not very common. Okay. Then question 17. Which of the following is considered as the safest antihypertensive drug in pregnancy-induced hypertension? AC inhibitor, methyl dopa or labetalol, atenolol or sodium nitroprusside. Very good. I have also discussed this topic. B. Very good. B. Anyone? Other people? Where are the other people? Okay. So let's see the safest antihypertensive drug. First is ACE inhibitor. So what does the ACE inhibitor does? It causes growth, fetal renal damage and leading to oligohydramnios. So this one is not safe. Okay. Whereas methyl dopa and labutalol, it is effective. Yes. Renal agenesis. Yes, also correct. Methyl dopa and labutalol is effective and safe drug and good fetal safety. Whereas atenolol causes fetal growth restriction. Okay. Then sodium nitroprusside used in emergency. And also there is a risk of cyanide toxicity in fetus. So the answer is methyl dopa or labetalol. And if the question comes, which of the following is the safest antihypertensive or the primary? What is the drug of choice for anti PIH, pregnancy-induced hypertension? If the MCQs are atenolol, methyl dopa, labetalol, or sodium nitroprusside, in all four, if A option is methyl dopa, B option is labetalol, C is atenolol, and D is sodium nitroprusside. What will be the drug of choice? Labetalol. Very good. So, the drug of choice of PIH is labetalol, and in second, it's the methyl dopa. Okay. So, the first priority will go to labetalol. Got it? Very good. So, let's move forward. Which drug is commonly used as an emergency contraceptive within 72 hours of unprotected intercourse? Levonorgestrel, mifepristone, copper T, or estrogen-only pills? A. A. Okay. So, emergency contraceptive pill is levonorgestrel. It is used within 72 hours of unprotected intercourse. Okay, 72 hours. That means 3 days. If it is used early, then the efficacy is high. Okay. Next question. Negri bodies produced by rabies virus shows characteristics, inner granules. Basically, the question is saying the rabies virus which produces the Negri body shows which type of characteristic. Is it neutrophilic? It is eosinophilic? Is it acidophilic? Or is it the basophilic? Negri bodies produced by rabies virus. Don't know, ma'am. Okay. Basically, the answer is eosinophilic, means pink color, pink stain. If we stain the Negri bodies which are produced by rabies virus, it shows the characteristics of eosinophilic. That means the stain of Negri bodies, if we stain it in the microbiology lab, it shows pink stain. Okay, whereas acidophilic gives red stain, basophilic gives blue stain, and neutrophilic means no stain, no color. Okay. It shows eosinophilic in nature. It is eosinophilic nature because Negri bodies are, it will be discussed in your microbiology subject. Pathogenomic, cytoplasmic inclusions. Because the Negri bodies, the cytoplasm inclusions of the Negri bodies has the pathogenicity inclusions. Neurons of infected. It is saying that the rabies virus is showing okay. So it is saying that Negri bodies produced by rabies virus shows which type of characteristics. If we extract the Negri bodies on staining means on staining, it will convert and it will show pink stain. Pink stain means eosinophilic. Okay, this is because the Negri bodies having the cytoplasm. That's why it is showing the pink color. Got it, Homendro? Is it clear? Just remember that Negri body shows eosinophilic character. It is just because of the cytoplasmic inclusions. Okay. So the next is involvement only cleaning surroundings. It is just a general question. Involvement only cleaning surrounding and toilet construction, but also sharing responsibilities and participation in one of the following. Means involving the community in cleaning surrounding and toilet construction as a shared responsibility. What is this showing? Meetings with barangay officers, defining health needs, problem-solving seminars, or social work about livelihood. Means the community is involving itself in the cleaning of surrounding, total construction. What are they showing? A is meeting with bargaining officers, defining health needs, problem-solving seminar, or social work about livelihood. As the community is involving themselves in cleaning and toilet reconstruction, the community is showing defining health needs because the community is participating in the health needs. Okay, so the answer is defining health needs. Got it? Is it clear? Can we move forward? No, the answer is defining health need. Okay. So the next question is, the nurse is caring for a child who has hemophilia. He is admitted with a bleeding episode. Which of the following should the nurse expect will be given to stop the bleeding? First is cryoprecipitate, packed cells, heparin, or whole blood. So this is your last question for today's session. The child is admitted with bleeding and the child is having history of hemophilia. So the nurse would give which blood product to stop the bleeding? Is it cryoprecipitate? Is it packed cell, heparin, or whole blood? Why Gayatri D? Hemophilia is a bleeding disorder. Any other answer? Yes. So there is no point of giving packed cell or the whole blood. There is no need for giving packed cell or whole blood. There is no need for RBC, plasma, because it is a bleeding disorder. And heparin is also an anticoagulant. So it will increase the risk of bleeding. There is a deficiency of factor 8 and 9, bleeding. So the answer is cryoprecipitate. Why? Because cryoprecipitate because it contains factor 8, fibrinogen, von Willebrand factor, factor 9, 12, 13, sorry, and it is used to help control bleeding. Got it? That's why cryoprecipitate is to be administered. Got it? In hemophilia, if the question comes that a child is having a history of hemophilia and the mother takes the child to the hospital, what should the nurse administer to stop the bleeding? It's cryoprecipitate because hemophilia is a bleeding disorder. There is no need for giving packed cell or whole blood. And heparin is nothing but it will increase the risk of bleeding. Okay? Because I've already told that cryoprecipitate contain factor 8, fibrinogen, von Willebrand factor. Okay? For hemophilia, cryoprecipitate is used. Got it? Is there any query? So with this, we are ending up with our session. Okay. We will continue in the next class the further questions. Okay. Okay. Thank you. That was really nice to interact with you people. Thank you.